Singapore Nursing Board important. Question and answers. 1. Impacted gallstone in which area caused jaundice? A. Cystic duct. B. Hepatic duct. C. Common bile duct. D. Gallbladder. Answer. Common bile duct. If a gallstone leaves the gallbladder and gets stuck in the bile duct, it may block the passage of bile into the intestine. The bile will then seep into the bloodstream, causing signs of jaundice. 2. An elderly woman had cardiac arrhythmia during thyroidectomy. When she returned to the word, what is the priority? A. ECG monitoring. B. Monitoring of vital signs. C. Nurse in lateral position. Answer. ECG monitoring. The most effective way to diagnose an arrhythmia is with an electrical recording of your heart rhythm called an electrocardiogram, ECG. If the ECG doesn't find a problem, you may need further monitoring of your heart. This may involve wearing a small portable ECG recording device for 24 hours or longer. 3. Causes of intestinal obstruction. A. Congenital hereditary. B. Hereditary abdominal injury. C. Ca stomach. Ca colon. Answer. Ca stomach. Ca colon. Causes of intestinal obstruction may include fibrous bands of tissue adhesions in the abdomen that form after surgery, hernias, colon cancer, certain medications, or strictures from an inflamed intestine caused by certain conditions such as Crohn's disease or diverticulitis. 4. Which is the best position to prevent increased intracranial pressure for a head injury? Patient also suffering from shock. A. Flat with head lower than the body. B. Elevate patient's head. C. Flat with lower extremities higher than the body level. D. Line flat. Answer. Flat with lower extremities higher than the body level. 5. What is the cause of hypoxia after subtotal thyroidectomy? A. Damage to the parathyroid gland. B. Thyroid crisis. C. Damage to the recurrent laryngeal nerve. D. Formation of hematoma leading to airway obstruction. Answer. Formation of hematoma leading to airway obstruction. 2 different surgical techniques are used for the treatment of Graves. Hyperthyroidism, a total thyroidectomy (TT) in which the entire gland is removed, and a subtotal thyroidectomy (STT) in which most of the gland is removed, leaving a small unilateral or bilateral remnant in situ about 4 to 5 grams. Major postoperative complications include wound infection, bleeding, airway obstruction, compressing hematoma, tracheomalacia, hypocalcemia, thyroid storm uncommon, usually associated with Graves' disease, and recurrent laryngeal nerve injury. 6. Effective measure of stop bleeding. Palm. A. Direct pressure on the wound. B. Elevate the affected hand. Answer. Direct pressure on the wound. Apply direct pressure on the cut or wound with a clean cloth, tissue, or piece of gauze until bleeding stops. If blood soaks through the material, don't remove it. Put more cloth or gauze on top of it and continue to apply pressure. 7. Name the commonest type of microorganism in septicemia. A. Pseudomonas and Escherichia coli. B. Streptococcus and Pseudomonas. C. Staphylococcus and Streptococcus. D. Streptococcus and Escherichia coli. Answer. Staphylococcus and Streptococcus. Septicemia is an infection that happens when bacteria or other germs enter the bloodstream and spread throughout the body. That can trigger sepsis, which is the body's reaction to the infection. The ones most often responsible are bacteria, including Staphylococcus aureus, Streptococcus pneumoniae, E. coli. 8. Before blood transfusion, we should start at 0.9% NSB DNS. C. 5% dextrose DRL. Answer. 0.9% ENS. Immediately prior to administration, 2 licensed personnel must verify the correct blood product and patient. Blood products require a dedicated line for infusion, and filtered intravenous tubing. Only normal saline should be used to prime the intravenous line, with no other solutions or medications used. The patient and family also need explanations of the procedure before beginning, including what to expect. Baseline vital signs should be taken just prior to initiating the transfusion, and the nurse must stay with the patient during the first 15 minutes of transfusion to monitor for any immediate reaction. Vital signs should be repeated at 15 minutes after the beginning of the transfusion, during the procedure per facility policy, at the conclusion, and 1 hour after the transfusion. 9. Hypovolumic shock is due to except A. Severe burn, B. Severe pain, C. Diarrhea, D. Bleeding. Answer: severe pain. The most common cause of hypovolemic shock is blood loss when a major blood vessel bursts or when you're seriously injured. This is called hemorrhagic shock. You can also get it from heavy bleeding related to pregnancy, from burns, or even from severe vomiting and diarrhea. 10. Giving sitz bath after haemorrhoidectomy is to reduce pain and A. Reduce hemorrhage, B. Promote bowel movement, C. Promote healing. Answer: promote healing. The warm water sitz bath is a routine nursing care after hemorrhoid surgery in the clinic. The purpose is to provide moist heat of the perineum and anus to clean, promote healing and drainage, relieve pain, stimulate urination and promote relaxation. 11. To prevent unconscious patient from complication of respiratory tract. A. Side lying. B. Head tilt, chin lift, C. Head tilt. D. Jaw lift. Answer: side lying. Proper patient positioning. Lateral. Recovery. Position: once conscious. Supine position. 12. Acute appendicitis emergency except A. Obtain consent, B. Nothing by mouth, C. IV drip. D. Enema. Answer: enema. Appendicitis is inflammation of the appendix. When the appendix becomes inflamed or infected, rupture may occur within a matter of hours, leading to peritonitis and sepsis. Preoperative interventions. Maintain NPO status. Administer fluids intravenously to prevent dehydration. Monitor for changes in level of pain. Monitor for signs of ruptured appendix and peritonitis. Position right side lying or low to semi-fowler position to promote comfort. Monitor bowel sounds. Apply ice packs to abdomen every hour for 20 to 30 minutes as prescribed. Administer antibiotics as prescribed. Avoid the application of heat in the abdomen. Avoid laxatives or enema. Postoperative interventions. Monitor temperature for signs of infection. Assess incision for signs of infection such as redness, swelling and pain. Maintain NPO status until bowel function has returned. Advance diet gradually or as tolerated or as prescribed when bowel sound return. If rupture of appendix occurred, expect a Penrose drain to be inserted, or the incision may be left to heal inside out. Expect that drainage from the Penrose drain may be profuse for the first 2 hours. 13. Appendectomy complication. A. Peritonitis. B. Bleeding. C. Chronic appendicitis. Answer: peritonitis. An appendectomy is surgery to remove the appendix when it is infected. This condition is called appendicitis. Appendectomy is a common emergency surgery. 14. How to promote a patient to get comfortable sleep except A. Give cold drink. B. Comfortable position, C. Bladder empty. D. Recommended sleeping drug. Answer: give cold drink. 15. Long time bed rest for heart failure patient. The main objective is to A. Reduce heart workload, B. Promote blood circulation, C. Increase cardiac contraction. Answer: reduce heart workload. Bed rest induces an elevated maximal heart rate which, in turn, is associated with decreased cardiac vagal tone, increased sympathetic catecholamine secretion, and greater cardiac beta receptor sensitivity. 16. How to prevent air not to go into baby's stomach. A. Expel air by rubbing back. B. Teat of bottle filled with milk at all time. Answer: teat of bottle filled with milk at all time. Babies often swallow air when feeding, which can cause gas. Almost all babies get gas. Gas happens when air gets into the digestive tract, such as when a baby sucks on a bottle and swallows air. 17. T-tube is an after colostomy for drainage of A. Bile, B. Blood, C. Pus. D. Lymph. T-tube color. Dark green, expect 300 to 500 milliliters of thick, blood-tinged, bright yellow to dark green bile drainage the first 24 hours after common bile duct explorations supraduodenal choledochotomy surgery. Answer. Bile. 18. Edematous point should take A. Low salt diet, B. Low protein diet, C. High residue diet. Answer. Low salt diet. Edema occurs when tiny blood vessels in your body capillaries leak fluid. The fluid builds up in surrounding tissues, leading to swelling. Treatment of edema includes several components. Treatment of the underlying cause, if possible. Reducing the amount of salt sodium in your diet, and, in many cases, use of a medication called a diuretic to eliminate excess fluid. Using compression stockings and elevating the legs may also be recommended. 19. The drug which reduces temperature is called A. Antipyretic, B. Antihypertensive, C. Antiemetic. Answer. Antipyretics such as acetaminophen, aspirin, and related nonsteroidal anti-inflammatory drugs, NSAIDs, reduce. Antipyretics such as acetaminophen, aspirin, and related nonsteroidal anti-inflammatory drugs, NSAIDs, reduce fever by depressing inflammatory messages at both peripheral sites of tissue inflammation and within central nervous system thermoregulatory sites. 20. In case of extreme poisoning of salicylate. A. Antiemetic. B. Peritoneal dialysis, C. Hemodialysis, D. VKINJ. Answer. Hemodialysis. Salicylate poisoning can cause vomiting, tinnitus, confusion, hypothermia, respiratory alkalosis, metabolic acidosis, and multiple organ failure. Diagnosis is clinical, supplemented by measurement of the anion gap, arterial blood gases, and serum salicylate levels. Treat with activated charcoal and alkaline diuresis with extra KCl. Consider hemodialysis if poisoning is severe. 21. The nurse highest priority for newborn with cleft palate and cleft lip. A. To feed newborn. B. To concern with parental anxiety. Answer. To feed newborn. Nursing goals for clients diagnosed with cleft lip and palate include maintaining adequate nutrition, increasing family coping, reducing the parents' anxiety and guilt regarding the newborn's physical defects, and preparing parents for the future repair of the cleft lip and palate. 22. The appropriate time for surgery for child with cleft palate. At 1-2 months, B. First 4 days, C. 2 to 6 months, D. After 1 year. Answer. After 1 year, a cleft palate usually is repaired with surgery called palatoplasty. Palatoplasty, when the baby is 10 to 12 months old. The goals of palatoplasty are to close the opening between the nose and mouth. 23. Nutritional needs of child with cleft palate and cleft lip. A. Spoon feed in sitting position, B. Parental root, C. RT feed, D. TPN. Answer. Spoon feed in sitting position. Place your baby in an upright, sitting position to prevent the formula from flowing back into the nose area. Use a small, flat spoon rather than a larger, deep spoon to make it easier for the mouth and upper lip. 24. The most appropriate treatment for ventricle fibrillation. A. Compression of the heart, B. Digoxin, C. Defibrillators. Answer. Defibrillators. Ventricular fibrillation is caused by either a problem in the heart's electrical properties or by a disruption of the normal blood supply to the heart muscle. External electrical defibrillation remains the most successful treatment for ventricular fibrillation, VF. A shock is delivered to the heart to uniformly and simultaneously depolarize a critical mass of the excitable myocardium. 25. CVP is established by 1. To assess hydration, 2. Arterial pressure, 3. Ventricle pressure, 4. Ventricle function. At 1 plus 2 B 1 plus 3 C 3 plus 4 D 1 plus 2 plus 2 plus 4. Central venous pressure, CVP, an estimate of right atrial pressure, has been used to assess cardiac preload and volume status in critically ill patients, assist in the diagnosis of right-sided heart failure, and guide fluid resuscitation. It is determined by the interaction between cardiac function and venous return. 26. Normal pressure of H2O manometer for CVP. At 1-5 mm of mercury B, 5-10 mm of mercury C, 1-5 cm H2O D, 5-10 cm H2O. Answer. 5-10 cm H2O. 27. Exact location of H2O manometers to assess CVP. A. Atrium, mid-axillary line. B. Lower axillary. C. Upper axillary. D. Axillaries line. Answer. Atrium, mid-axillary line. CVP is usually recorded at the mid-axillary line where the manometer arm or transducer is level with the phlebostatic axis. This is where the fourth intercostal space and mid-axillary line cross each other, allowing the measurement to be as close to the right atrium as possible. 28. Aspirin is not given in A. Peptic ulcer. B. Infection. C. Inflammation. D. Fever. Answer. Peptic ulcer. Some medical conditions, such as pregnancy, uncontrolled high blood pressure, bleeding disorders, asthma, peptic stomach ulcers, liver and kidney disease could make aspirin a bad choice for you. 29. One of the initial symptoms of esophageal tumor. A. Difficulty in swallowing of solid food. B. Projectile vomiting. C. Bleeding. D. Hoarse voice. Answer. Difficulty in swallowing of solid food. The first symptom of esophageal tumor that develops in the esophagus is difficulty swallowing, which may feel as if food is stuck in the throat and may lead to choking. 30. Nurse assessment in incompatible blood transfusion. A. Allergic reaction. B. Hemolytic reaction. C. Increase in temperature. Answer. Hemolytic reaction. If you receive blood that is not compatible with your blood, your body produces antibodies to destroy the donor's blood cells. This process causes the hemolytic reaction. Most hemolytic reactions are the result of human error, such as the transfusion of properly labeled blood to the wrong patient, or improper identification of pre-transfusion blood samples. Symptoms: chills, fever, pain along IV line, back, chest, hypotension, dark urine, uncontrolled bleeding due to Dick.